Hi, I'm Tory Martin, and I was working for the airlines as a customer service supervisor. I did a lot of typing, and I started to get some pain in my hands and arms. When I went to the doctor, several doctors actually, finally I was diagnosed with RSD, which is a nerve pain that comes from, one of the symptoms is from repetitive work. So that's how I got my pain syndrome. Before I came to Dr. Adams, when I was given that information from the doctor, I was pretty distraught. He had recommended a pain program, and he'd recommended Dr. Adams' 12-week program. So I went ahead and started that several months ago. I've been dealing with chronic pain since April of 2000, so this is my third year. And without any help and, no way to learn how to deal with it or anything.
My name's Emery Hall, and I'm an eye doctor. Tori's my sister, and we both came down with the RSD at the same time, although neither one of us knew it at the time. Mine was from an injury, hers was from repetitive motion, and so it's kind of an interesting set of circumstances. I was a full-time clinical, doc, seeing patients, 30 patients a day, very busy, excellent practice, and I fell from a ladder. It was a second fall. I had a very serious injury to my elbow, and I've actually had, multiple surgeries on it. I've flown back to the Mayo Clinic. Had the elbow guys back there do some work on it. It's not repairable. You can't have an artificial limb put in, or artificial joint put in. And then I contracted the reflex sympathetic dystrophy on top of it. So besides the very disabling injury to my elbow, I have the reflex sympathetic dystrophy is over and above. However, there's two types, and she has the one type, and I have the opposite type. Very interesting set of circumstances that a brother and sister would have it, at the same time, and yet neither one of us knew it for 9 months that we, had anything that was even remotely similar, other than that we both had pain. By the time they identified it, we actually had a 12-year-old cousin who contracted it, and she was actually hospital bound for 2 to 3 months. Hers became much more severe, but she recovered pretty significantly. Right, because she's a kid. Right, they diagnosed it right away, and ours it took almost a year for myself. I don't know.
Almost 2. It was pretty bad in the beginning because first of all, it was hard to get a diagnosis, and I was just in so much pain. Anytime I used my arms, I just had a lot of pain, and you use your arms all day long, every day. So I was no longer able to work, which is a financial impact, but. The pain got so bad that I didn't want to do, I couldn't play with the kids, couldn't do any kind of sports or anything. Going out with friends was not really an option because I was too miserable. I was just pretty much sitting and being miserable in my pain, And my husband was very understanding, but yet didn't understand what was happening because I didn't understand until I came to Dr. Adams' course and learned about it. He's, so knowledgeable on pain that he made it, where we could understand and actually live again. For
myself, when it first happened, I thought, well, I know how all this stuff works. I don't need to go see anybody about it. I understand this very well. And Tori pretty much, convinced me to come. And, I did it as much for support for her, not realizing the benefit that I would get from it. Mine had a pretty substantial impact. I went from full-time practice. It just slowly dwindled down till essentially I'm not practicing at all right now.
We live close together, and he's got 3 children and I have 2 that are spent a lot of time together, and they would go from house to house hearing these people devastated and frustrated and in a lot of pain, and the kids were kind of like, geez, we can't go anywhere without someone whining about pain. And it's drastically changed our lives since we've been at
Dr. Adams' program kind of has two aspects. There's sort of like the first course, which lasts about 3 months, and then he has an ongoing weekly program following that. And when you discover other people that have the same condition, especially when you have something that's kind of rare like what we have, it's great to hear somebody else, not great to hear that they have it, but great to hear that they have similar type symptoms as you, which may be kind of bizarre in their own right. It's nice to have other people in the group because they, very specifically disease, specific, have knowledge of what you're going through. And not that I necessarily felt like I needed the support from other people, but it sure was reassuring to know that I wasn't, crazy by having all these, strange pain, occurrences and whatnot with my disease.
Family, how it's affected our family is, before we were, you're very weepy and very depressed and that type of thing when you're in a lot of pain. Oh, you want to be fixed today.
Right.
You want to be fixed right now, today. I have to have this done, because I'm losing my life, And now I can sit back and say, you know what, everything in its time, I'm glad that I'm able to function the way I'm functioning. I did physical therapy for a year, pretty much nonstop. And while I was in the therapy, it helped, but every time I stopped after 2 weeks, the pain came back. I mean, it helped. It didn't stop. It helped it. But every time I stopped going to physical therapy, the pain came back even worse. And so I learned in Dr. Adams' course, he had us go to a pool, and 92 degrees, and so we went to the pool, and there was significant difference for me. So after doing the 12-week course in the pool, I went ahead and bought a therapy pool for myself at home because it makes that much of a difference. And at first I thought, oh, I've already been through all the therapy there is, but the water therapy is a world of difference. And that was what we got out of Dr. Adams' class also.
She has the therapy pool. She actually got it relatively recently, and so I've been wanting to go over and try hers out because I found that, for whatever reason, he's right when it comes to the therapy pool too, and I've fought him on it, and I think I'm losing this battle.
I would thoroughly recommend this course to every pain patient because it doesn't matter how severe your pain is. It needs to be addressed and how to live with it because pain is different for everybody. I so much recommended it that I brought my brother and had him come, and he agrees as far as I think he's actually surprised at how much of a difference it makes going through Dr. Adams' course.
I suppose initially for me, because I was skeptical, and in fact, if I hadn't really sat and thought about it, I don't know that I would have identified the fact of how much he was actually helping me on a day-to-day basis.
And our spouses have learned a lot through us because we come home and share what we've learned from Dr. Adams and how not to dwell on the pain and how to move forward from it. So from having kind of sad, depressed families to being back lively and happy and joyful, it's really made a major, major impact. Yeah. We're actually able to be normal, be happy, and know that our pain, we don't have to be afraid of our pain. Before it was very scary, now we so understand it and every aspect of it and what to do when it breaks through and that type of thing, that it's not scary anymore, so it doesn't have to be the focus of our conversations.